So good morning, good afternoon, good evening. Welcome to the Patient First channel. This is the channel where we consider our patients to be the kings and queens. The hospital is their kingdom, and we doctors and nurses are their servants. Welcome, and welcome to today's episode. So today I'm super excited to be completing my internal medicine rotation. It's been a wonderful experience. Thanks to my bosses, the junior residents, the senior residents, and that of the consultants. It's been a really wonderful working experience. However, for the past few times I've practiced medicine for, I've come to realize that affordability is a serious issue. Sometimes you are giving your absolute best for your patient, but when you turn to give your request for routine labs and prescription for medications that are needed so urgently, the family members just sit there and stare at you, some with even tears in their eyes, saying that we cannot afford. And the next thing, they are going to bring a letter for discharge against medical advice. And sometimes that sends an emotional shock to your spine because you know the outcome. However, there is a partial solution to the problem of affordability, even though it's not a total solution to the problem of affordability. But however, there is the National Healthcare Insurance, and this is the healthcare insurance that is saving a lot of lives. It has improved the health status of the Ghanaian population, and it has even increased the life expectancy of Ghanaians. So it's something that is really providing value to a lot of the populations who cannot afford basic health care. And I really wish this could be replicated in Liberia. And if it is, this will be the greatest gift any politician, any government can give to the people of Liberia, the struggling masses. Now let's talk about the National Healthcare Insurance. So the National Healthcare Insurance of Ghana covers almost 95% of the diseases, the illnesses that are affecting the entire populations of Ghana. It covers both inpatient care, it covers both outpatient care, it covers labs, it covers emergency, it covers obstetrics and gynecology. I mean, all spectrums of diseases and emergencies that are affecting the Ghanaian population. And there is something that I would also like to really emphasize on, that is the medications list. There's a whole list of medications that are on the National Healthcare Insurance. And this is something that I've realized approximately 80 to 90% of doctors do not know the medications that are on this National Health Insurance. And this is something that if we are aware of, we can be of so much help. We can be of a blessing to our patient financially. Now I would like us to take a look at the various benefits or services that I provided on the National Healthcare Insurance. Now let's take a look at the outpatient care. This is the whole list of the outpatient care. It ranges from malaria, respiratory tract infection, HIV, and even OPD consultation. And then you have the inpatient care. For the inpatient care, it covers medications, which we will be discussing in just a minute. So it covers labs, it covers general ward stay. It also covers most of the surgeries. You see, when you compare the medical bills for those who are on the healthcare insurance and that of those who are not on it, you realize that those who are not benefiting from the healthcare insurance pay 3 to 4 times, even 5 times more as compared to those who are on the healthcare insurance. So you have the same patient with the same condition, but one is on the healthcare insurance and is paying like 500, while the other on the not on the healthcare insurance is paying close to 1,005 or 2,000 Ghana cedis. So this is really providing values to our patient, and this is what we are even here for as the patient first channel. Now let's look at the medications list. I want you to look at the screen. This is the medication list, and my appeal to every medical practitioner practicing here in Ghana, kindly, not just only medical practitioner, but patient. These are people who even need this list the most. Why am I saying this? Because we doctors, when we are at the clinic, you have like 20 to 30 patients to see when you are having your consultation. Trust me, how much time do you have to see all of them? And then you have to prescribe medication for them. You write the prescription on the normal prescription form, and you have to transfer that prescription to the Form J, which is the healthcare insurance form, before the medication can be issued. Trust me, we don't have that luxury of time. So you find out that doctors only write the medications on the normal prescription form and give it out, costing our patient more and more financially. So this is one thing I also recommend to the National Healthcare Insurance and even to the Ghana Health Service. If we can have just one prescription form that will cover both insurance and that of the normal prescription form, where they can take it anywhere. Because at times doctors are not using the Form J. It's time consuming, honestly. So this is just a little way we can help our patient. Now let's take a look at the medications that are on the National Healthcare Insurance. These medications, there are a wide range of medications, and they cover different scopes of diseases across the broad spectrum. It covers antihypertensive, it covers anti-diabetic medication, it covers pain medication, and if you are admitted, most of your IV fluids are covered under this medication. Like, I was so amazed when I went through the list of medications that are on the National Healthcare Insurance. Honestly, I've been prescribing those medications. The patient have been buying them out of their pockets. But this is something, if we all can have access to it, I'm begging again, please click the link below, download the list on a PDF. And if you have a PDF reader as a patient, as a nurse, or as a doctor, all you have to do is just go to the medicine list, click the search box in your PDF and search the medication what is on the healthcare insurance, and just prescribe that for your patient. It will provide tons and tons of value for the patients in our part of the world. The economy of Ghana is something that is in a free fall, and things are absolutely difficult. So with a little assistance that we can provide to these people, that will be a help. Now I've color-coded the list, so all you have to do is to just go through it, download it, and provide a service for your patient. This will be a blessing. The list is here, and if you want me to take you through it, this is the list. So I've color-coded the list. If you download, you will see my highlights on the list. So you have medications that cover heart disease and other complications related to heart disease. So they are color-coded in red. And then you have the antibiotics. Like, I was so shocked. Majority of the antibiotics that we use here on a daily basis are covered on the National Healthcare Insurance. So you see the antibiotics there, they are color-coded in blue. Please forgive my colors. I only see blue and the primary color. And then we have green to be the IV fluids. Almost all the IV fluids are on the National Healthcare Insurance medicine list. The normal saline, gilafilsin, the dextrose normal saline, 5%, 10%, even 50% dextrose is on the normal on the National Healthcare Insurance. And then we have the pain medications, which are in purple. Almost all the pain medications are there. You have the you have morphine, you have diclofenac, you have paracetamol. But one thing I want to make clear is that IV paracetamol is not on the national healthcare insurance. So if you are prescribed, we prescribe that a lot here. And if you are prescribing it, just know that it's not on the healthcare insurance. And then we have the anti-diabetics, which have color-coded in yellow. Almost all, we have metformin, you have the glibaclamide, they are all on the national healthcare insurance, and other medications. You have medications for psychiatrists. But there's something that I also like to discuss, the services that are covered under the national healthcare insurance. One thing I would like to make clear is that dialysis is not covered under the national healthcare insurance. You have brain surgery, heart surgery to be covered under the healthcare insurance, but partially. You only have access to those facilities covered under the national healthcare insurance if you are involved in an accident. If you are not involved in an accident, you pay cash and carry. This is one thing I'd like to make very, very clear. So these are services that are offered to the Ghanaian population. Thank you, and thank you so much. Watch out for our next episode. Kindly subscribe to this channel. Next episode, we're going to be talking about how much doctors make here in Ghana, converting that to US dollars. And then we also going to be comparing it to other African nations and see the difference in comparison. Thank you so much.